You used to walk a mile without thinking about it, and now you can barely make it from your car to the grocery store entrance before your legs start feeling uncomfortable. Your back hurts, but the worst part is in your back. It's your legs. They feel heavy, numb, like they're filled with concrete. So you stop, you lean forward on the car, and within a minute or two, the pain feels better. You stand up straight, take a few steps, and it comes right back. If that sounds like your life right now, you almost certainly have something called lumbar spinal stenosis. And I know it's frustrating because you've probably been told that it's just aging, or that you have arthritis in your back, or that your MRI shows a little narrowing, but nothing that should cause this much trouble. Here's what nobody's telling you. That walking pattern, bent forward, leaning on the shopping cart, sitting down to recover, is the single most reliable sign of what is actually happening to you. And once you understand it, the rest finally makes sense. In the next 15 minutes, I'm going to walk you through three things. First, what lumbar spinal stenosis actually is at the level of the bones, the nerves, and the spinal canal they live in. Second, why your symptoms behave the way they do, why walking is hard, why sitting helps, why a shopping cart is your best friend, and why bending over a counter feels good. And third, what you should do next. Not the treatment itself, that's the next video in this series, but what to ask, what to look for on your imaging, and how to figure out where you actually are in the bigger picture. By the end of this, you're going to understand your spine better than most people who walk into my clinic with a stenosis diagnosis. I'm Dr. Omar Ramos. I'm a spine surgeon at Twin City Spine Center in Minneapolis. Lumbar stenosis is one of the most common conditions I treat, operatively and also non-operatively. I've sat across from thousands of patients who came in confused, scared, and unsure whether what they had was just aging or something that needed real attention. By the end of this video, you'll have the language to have that conversation intelligently with whoever's taking care of you. Let's start with the anatomy. Your lumbar spine, the lower back, is made of 5 bones called vertebrae stacked on top of each other. In the middle of each vertebrae is a hole. When you stack them, those holes line up to make a tunnel. That tunnel is the spinal canal, and inside it run all the nerves that control your legs. Stenosis just means narrowing. Spinal stenosis means the tunnel is narrower than it should be. Lumbar spinal stenosis means it's narrower in your lower back. Now, here's where it gets specific, because not all stenosis is the same. The narrowing can happen in 3 different places, and the location matters because it changes which nerves get pinched and what your symptoms feel like. There are 3 types of lumbar stenosis, and you should know which one you have. First, central stenosis. The main tunnel is narrowed. This affects the bundle of nerves running down through it. Second, subarticular or lateral recess stenosis. There's a small alcove on each side of the canal where a nerve root is heading out towards the leg. When that alcove is narrowed, the specific nerve heading to that one leg gets pinched. The third area is foraminal stenosis. The hole the nerve travels through to leave the spine, the foramen, is narrowed. The nerve gets pinched at the doorway on its way out. The 3 patterns can occur alone or together, and which one you have changes everything about your symptoms. In my practice, the most common patterns by far are central and subarticular stenosis. Pure foraminal stenosis is less common, although it still affects some patients. So why does the tunnel get narrowing in the first place? 3 things, mainly, and they almost always happen together as your spine ages. 1, the discs between your vertebrae lose height and bulge backwards into the canal. 2, the ligaments lining the back of the wall of the canal, especially one called the ligamentum flavum, get thicker. Imagine a curtain in your house slowly turning into a wool blanket. That's number 2. 3, the small joints connecting each vertebrae to the next, those are the facet joints, develop arthritis. So they get bigger, bonier, and they also encroach into the canal from the back. Bulging discs from the front, thickened ligament from behind, and bony overgrowth from the back and the sides. The canal that used to have plenty of room now has very little room. The nerves that used to glide freely now have nowhere to go. That's stenosis. And here's the part most patients don't get explained to them. And it's the most important part, because if you understand why stenosis behave the way it does, the diagnosis become obvious and things make sense. Stenosis has a signature, and once you know what to listen for, you can almost diagnose it from a 1-minute conversation. Here's the signature of lumbar central stenosis. Tell me if this is you. You can stand at the kitchen counter for a little while, but after a few minutes, or once you start walking, your legs start to ache, burn, or go numb. Not your back, your legs. When you stop and lean forward on a counter, a railing, or a grocery cart, the pain improves within a minute or two. Sitting down for a few minutes also makes it improve, but standing upright again, walking again, and it comes right back. That's not random. That's not just aging. This is one of the most specific symptom patterns in all of orthopedic medicine. It's called neurogenic claudication, and it tells me before I see a single image that your spinal canal is likely narrowed. The reason this pattern exists comes down to one fact. When you bend forward, the canal opens up. When you stand up straight or extend backwards, the canal closes down. That's why a shopping cart is the most reliable diagnostic tool in the grocery store. Patients with stenosis lean on the cart, hunch forward, and they can keep going. Take the cart away, and they have to stop after a while. It's why stenosis patients tell me, I can ride a bike forever, but I cannot walk to the end of my driveway, because cycling is done in flexion. The canal is open, the nerves have room. It's why you sleep better in the fetal position, why bending over the kitchen sink to wash dishes feels good, why a recliner is more comfortable than a flat bed. It's not coincidence, it's the anatomy. Now, let me address something important, because there's a condition that mimics stenosis closely, and missing it is a serious mistake. There is another condition that causes leg pain when you walk. It's called peripheral arterial disease or vascular claudication. The arteries in your legs are narrowed. When you walk, your muscles don't get enough blood, so they cramp. The pattern can sound very similar at first because you walk and it hurts. You stop, recovers, and then you walk again and it hurts again. But the differences matter because the treatment is completely different for these two conditions. With vascular claudication, the pain stops when you stop, even if you stay standing. You don't need to bend forward, you don't need to sit, you just need to stop and rest the muscles. With stenosis, simply stopping isn't enough. You need to change your spine position, bend forward, sit down, lean on something. That's the cleanest, distinguishing question I ask in clinic. When your legs hurt and you stop walking, do you have to lean forward to feel better, or does just standing still do the trick? If just standing still relieves it, there's a real possibility your problem isn't your spine, it's your circulation. And that gets investigated very differently. This is one of the most important reasons not to self-diagnose from a YouTube video, including this one. The pattern recognition I'm teaching you is a starting point for a real conversation, not a substitute for one. Now, your MRI. Almost every patient I see for stenosis brings their MRI report, and almost every report uses 3 words: mild, moderate, or severe stenosis. Here's what I want you to know about those words. They don't predict your symptoms. I see patients every week whose MRI looks frightening. Severe central stenosis, the canal almost completely closed, and they are walking 3 miles a day with mild discomfort. And I see patients whose imaging looks mild on paper and they can walk to the end of the block. This isn't a contradiction. It's a feature of how the spine works. Your nerves can adapt to slow narrowing if there is still enough room when you bend forward. 2 people with identical looking MRIs can have completely different lives. The most important thing on your stenosis evaluation is not the MRI, it's the story, the walking distance, the position dependence, the way the symptoms behave. The MRI confirms what the story already tells me. It doesn't replace the story. Your MRI may say severe, but you're walking fine, or it says mild, but you cannot walk to the mailbox. That's not a mistake, that's normal. The words mild, moderate, and severe on an MRI only describe how narrow the canal looks in a still picture. It doesn't tell me how the nerves are feeling inside it. 2 people with the same MRI can have completely different lives because the body adapts. The story matters more than the picture. The walking distance matters more than the millimeters. If you're hung up on a word in your MRI report, just let it go. What we treat is what you're experiencing in combination with what we see on those MRIs, not what we see by itself. So if you're watching this and the symptoms sound like yours, what should you actually do next? 3 things. 1, get an accurate description of your walking distance and what stops you. Not, I have back pain. Specifically, how far can you walk before your legs start to bother you? What makes them stop? What makes them recover? Bring that to your doctor. That conversation is more diagnostic than any test. 2, if you haven't had imaging yet, the standard is an MRI of the lumbar spine without contrast. X-rays alone don't show stenosis well. They show the bones, but stenosis is mostly about the soft tissue narrowing, the disc, the ligament, and the nerves in the canal itself. And 3, understand that a stenosis diagnosis is not a sentence, it's a start point. There's a real range of treatments that help. Most patients don't need surgery, especially early on. The question isn't, do I need surgery? The question is, what's actually happening and what's the right next step for me? In the next video in this series, I'm going to walk you through what actually helps stenosis without surgery. There's a lot of good options. There's also a lot of things people try that waste their time and money. I'll be honest about which is which. If you found this helpful, the best thing you can do is hit subscribe and the notification bell so you can see the rest of the series. And if you have questions about your own situation, drop it in the comments. I read them. The questions you ask shape the videos I make next. I'm Dr. Omar Ramos. I'll see you on the next one.